How do you build a high-performing culture? This is Culture Architects. Candid conversations with extraordinary leaders sharing their biggest successes, failures, and lessons learned on their culture journeys. Here's David J. Friedman.
Joining us on Culture Architects today is Dr. Roger Gerard. Roger is the owner of Sloan & Gerard Consulting. He's also the author of Lead with Purpose, Reignite Passion and Engagement for Professionals in Crisis. Roger brings with him to the show 5 decades of experience as a healthcare executive and leadership consultant. Dr. Roger was Vice President for Human Resources at Northern Michigan Hospitals, and later he was the Chief Learning Officer at the Wisconsin-based healthcare system called ThedaCare. His wealth of experience, of course, goes well beyond just the healthcare industry, so we're excited to chat with him today about all things leadership and, of course, all things culture. So, Roger, welcome to the Culture Architects podcast.
David, thank you for having me here. This will be a fun conversation.
Absolutely. So let's get started with a little bit of your background. So I saw I know from your educational background, you have a background in humanities and philosophy. I was a philosophy major in school as well. So we're both philosophers at heart. So how did you go from that background in humanities to get into most of your career into the healthcare industry? What was the origin that led you into healthcare?
Well, my very first career position after I got my bachelor's degree was with the American Cancer Society in Michigan. Okay. And in that role, I became acquainted with the healthcare industry from a little bit of a distance. But I got myself deeply involved in the training and development of people doing cardiopulmonary resuscitation. That's how I learned how to do mass training and how I got acquainted with people in the healthcare industry who were doing marvelous, marvelous work. I was dealing with rescue people. I was dealing with nursing and physician folks in hospital settings. I was engaged in an industry right out of college that impressed me significantly. Even prior to that, while I was in my undergrad work, I spent 2 years mopping floors and doing housekeeping work in a hospital in the Detroit area. So I had that inside exposure that led me into that kind of a career. From there, I directed a 3-hospital training consortium in Michigan, in the Detroit area. For 2 years, and then I moved from there into a role with the American Cancer Society and spent almost 4 years as the director of field services for the Detroit metro area of the American Cancer Society, where we did all of our service programming, fundraising, some of the education programming in the community. And I learned the ropes of leading people and creating boards and creating committees in the community, volunteers who wanted to do some good work. Out of that, I jumped into manufacturing. I spent 3 years in the manufacturing industry with Gulf Western Manufacturing doing leadership development, which was great fun.
As I think about the healthcare industry, if we just start there, you commented, Roger, that you've seen so many dedicated, committed people in healthcare that really have a passion for wanting to make a difference for people. And yet I'm imagining that in the various experiences that you had, having seen so many different professionals, I would bet that while you've got a whole bunch of people who really care passionately about doing great work, they were working in different environments. And I imagine you saw some of those environments that cultivated people being able to do their best and other environments that made it hard for people to do their best. Talk to me a little bit about what you've observed in the differences between those and how it impacted people who all genuinely wanted to care and to do great work.
Absolutely. I love the way you frame the question. People who go into healthcare or teaching or some of the other service kinds of industries, they all come into that with a bit of a mission. When you interview them, when you talk with them at any depth, what they tell you is they want to help people. They come to the party with an internal drive to do something that adds value to somebody else's life. That is a special kind of person. Those folks are doing this as more of a calling, a vocation, than for great wealth or great renown. They're not there for that. They're there to make a difference in somebody's lives. And I learned that when I was a housekeeper in a hospital. I learned that again when I was with the Heart Association and the Cancer Society. As I met all of these wonderful people, I was struck by how they worked from a point of view of a mission. After my 3 years in manufacturing, I was invited by one of my previous bosses to come up to Northern Michigan and be part of a hospital organization up there as their director of organizational development. I did that and became the director of human resources as part of that journey over 8 years and part of the senior executive staff. And I was still very much struck by how much people cared about the work that they were doing. That transferred to my work in Appleton, Wisconsin at ThedaCare. Again, another healthcare system where I was a senior executive working with all kinds of professions. And again, they cared. They cared deeply. And to me, that has been a blessing in my career, that I've had the opportunity to see this in so many different locations and so many different ways of doing healthcare work. The difference is more attributed to the people doing the work than it is to the way these people were managed. In many of those cases, the professionals had a little bit of a love-hate relationship with the folks in suits. And I was one of those suits. But having said that, they were able to kind of overcome that little bite and really stay with their calling and stay with their profession and do the work they loved. What concerned me in the last 10 years is that I've seen a shift in that. I've seen a big shift in that, primarily in the healthcare industry, but I've seen it in other industries as well. About 5 years ago, I wrote a book called Owning the Room. That book was kind of a post, quote unquote, retirement, which I don't use that word anymore. I now use the word repurposing. But after I left ThedaCare and started doing independent consulting, what happened is I was researching Owning the Room, and I started feeling a level of alienation that I hadn't seen. Owning the Room was about leadership. It's about taking responsibility as a leader and owning the job of building the culture, building the framework for highly effective, outstanding performers in healthcare. What I learned is that people weren't feeling well treated. People were not feeling like they could take the time they needed for themselves and for their families and for the other people around them and for the other dimensions in their lives. And as healthcare has become more measurement focused and business focused, the alienation has increased.
So you see a change in that.
And now it's all about leadership. Now it's all about how effective are leaders in instilling in that relationship with the people doing the daily work a sense of value and a sense of belongingness. It's about community. It's about bringing people together to do great work in an environment where they feel like they are valued. And that alienation is harming the healthcare industry, it's harming patient care, and it's harming the professionals.
Yeah. So I want to go back a little more historically in the observations that you've had and then bring that up to the current. So in the past, you've worked in these various places. And as you said, as I hear you saying, you've seen, it sounds like, pretty consistent level of passion, commitment, dedication to purpose among workers in healthcare. And yet, again, I'm guessing that while if I'm one of those healthcare providers, whether I'm a physician, a nurse, a assistant, a technician, whatever, I may have tremendous passion, and yet my experience, at least, is if I work in a place that supports me, that engages me, that rewards me emotionally and otherwise, it enables me to do the best work that I could possibly do. And conversely, if I'm in an environment where I'm constantly fighting against the environment, it makes it a struggle for me to live out the passion that I have. And so I'm imagining that you've seen lots of different kinds of environments, and even within a hospital system, I'm sure there are different offices, different departments where some of them really nurture the ability of providers to do their best and some don't. So talk to me a little bit about what you've observed in the areas where they do it well, what happens, and the areas where they don't do it well historically. What's the difference?
The difference is there are several elements in trying to define what's different.
Okay.
For instance, you're very right. Different context creates different dynamics.
Mm-hmm.
For instance, if I'm working in with a group of people in the ER, the
Mm-hmm.
emergency area of the organization, the psychology in that environment is very different than, say, out on med surge or in an office setting in the hospital institution, where things are a little bit calmer and easygoing and not so much emergent psychology going on. You have different kinds of people in different kinds of environments, and you have to pay attention to those differences as you're trying to craft community, as you're trying to create a cultural set of values
Mm-hmm.
that help drive what's going on. You can rise to a high level and say, okay, the organization needs a core mission that everyone understands, a vision for the future that everyone understands, and a single set of core values that we're all going to adhere to in order to in order to understand how we're going to relate to one another.
Mm-hmm.
We also need to understand what the organization is doing strategically so that we can all be aligned with that as professionals. Those are the givens in
Right.
every large organization. But when you start winnowing down into the different parts of the organization, you find you have different tribes. You
Mm-hmm.
have different ways of thinking and different ways of doing things. And one size fits all does not work. You cannot do it that way.
Sure. So,
Yeah.
but let's go back to,
Yeah.
I hear you saying that an emergency room is going to be different than a doctor's office, than different a med surge office, et cetera. And yet I'm imagining, and you can tell me if you see otherwise, but if you saw 15 different emergency rooms, so let's control for it's all emergency rooms. If you saw 15 different emergency rooms, I'd be willing to bet there's 15 different cultures, and some of them end up being a hell of a lot more effective, and some are less effective in
Yes.
enabling people to do their best work. So I'm wanting to get clear on, so among the ones in whatever the department is, if I'm comparing just emergency rooms versus, or I was looking at 15 different med surge operations, what do the best ones do? And when I'm going to say best, I'm talking about ones that enable their staff to live their purpose most successfully. What do the best ones do that the others don't? What's the difference between them?
I love that. Let me start with the beginning. The best ones
Mm-hmm.
have leadership that understand what people need from them as leaders.
Okay.
And very often, people move into leadership without having the requisite training to become highly effective leaders.
Mm-hmm.
Most people move into leadership from in an industry like healthcare, move into leadership with a very defined set of knowledge and skills that is more technical and science-based than human-based.
Okay.
And so they haven't received the necessary training to understand what people need and want from their work and from their role in the organization. I think it's incredibly important for leaders to spend a concerted amount of time, not just generally, but individually, to find out what people in their charge want and need from their profession. And leaders don't take the time to do that. I can't tell you how many times I've interviewed staff in focus groups or individually and asked them how they get along with their leader. And people have looked at me with wide open deer eyes saying, I don't even know who my boss is.
Wow.
I haven't seen my boss in more than 6 months. They're so busy in meetings and so busy in doing the administrative tasks that they think they're supposed to do because of their science-based background. And they're not taking the time to craft the relationships that cause people to feel seen, heard, and acknowledged. That's so critical in everyday leadership, and it's missed by people in leadership. And the profound difference you're looking for is a leadership difference.
Got it. And would you say, I know most of your career has been in healthcare, but you mentioned you spent a few years in manufacturing. Was there anything different about that in manufacturing, or it doesn't really matter what the industry is from your perspective? It's still leadership.
Some of both. People are people, and so the processes are pretty conformed and pretty common. In manufacturing, you have a product. In manufacturing, you have a very, very clear process for producing that product and for introducing that product to your customers. Much of manufacturing, unfortunately or fortunately, depending on your point of view, and we can talk about that, much of manufacturing is very systemized. And so people's roles are clear, their task distribution is clear, their relationships are clear, we all know who's in charge. And so there's a lot more clarity about how people work than what you find in most, what I'll call professional environments, where people have a lot more professional autonomy to do their work according to their own professional training. So there are some differences that you have to address and recognize as you do this work. But in healthcare, you have to understand that you're dealing with people who are practicing their professions. And autonomy for most of these professions is a very, very important feature of their profession. They have to be able to exercise judgment in situations where there aren't clear answers. That makes a big difference. Leaders have to understand that and recognize that as they work with their staff.
But ultimately, what I'm hearing you say is that in your experience, matches my own, excuse me, that in your experience, the biggest factor, and correct me if I'm saying this incorrectly, but in your view, the biggest factor that drives the creation of the kind of culture that helps people to be successful is that it starts with leadership.
It all begins with leadership. Just a kind of an anecdote about that. I was called in by a senior VP in one organization to join one of their staff meetings. And I walked into the conference room and there were 30 supervisors and managers. And this executive was in the front of the room attempting to lead a conversation about the concerns and issues that were affecting the management team of the organization. She asked them a basic question. Does anyone have any concerns they want to put in front of the group? Not a hand went up.
It must have been a perfect group.
Total dead silence. And she was about to say, okay, the meeting will be adjourned. And I cut her off. And I said, would you like a little help with this? And she said, sure, come on up. And so I went up to the front of the room and I broke them into 4 groups of about 8 or 9 people each. And I asked them to brainstorm, what are the biggest Excedrin headaches they contend with every day? What is their best advice to their executive leadership? And if they could have the world just the way they wanted, what would be the most important change they would make in how things are being done? The room exploded.
Yeah.
They were hungry to have their voices heard, but they couldn't do it in that group of 30
Mm-hmm.
people with the executive in front of the room taking names and taking notes.
Mm-hmm.
That wasn't going to happen. But this is an example of a leader responsible with great responsibility who didn't have a clue
Mm-hmm.
how to engage with the very important professionals working with her.
Yeah. And what's interesting about that anecdote is, I would guess, obviously I don't know the person, but I would guess that leader, at her core, she cared. She wanted
Yes.
to address their issues. She just, to your point, had no clue, no skill set for how do I effectively bring that information forth, and therefore do something
That's
with it.
exactly right. She was a scientist, and
Mm-hmm.
she got to her role because she was a really good nurse.
Mm-hmm.
But nobody had given her the time or the training to say, now you're in a different world. Leadership is
Yeah.
not the same as nursing.
Yeah. So if I kind of summarize what I hear you saying, is that across almost all organizations, at the end of the day, in order for people to be able to perform at their best, they need to be in the right kind of environment, and leadership has a significant role in shaping that environment, or it's really their culture. And that further, if we look at most leaders, if not certainly a large majority of leaders, might be well-intentioned, but don't have the training or the skill set to effectively deal with the human side of their people. Maybe they can deal with the scientific side or whatever the product or service happens to be, but the human part of understanding people and being able to relate with people and connect with them is missing for many leaders. And that's the part that's the biggest gap that you say. Is that an accurate?
Yeah, I did an interesting experiment with that, and what I can do is I can tell you what that gave me. I asked a basic question.
Mm-hmm.
I asked, what do you as a professional really need from your leaders? And I did probably 20 focus groups on this to kind of distill it down and see what I could learn across different professional groups.
And before you tell us the
answer,
I have a question for you.
Yeah.
Did you have a hypothesis about what it would be, and did the result differ from what you were guessing it might be?
My hypothesis would be they need to pay us more. They need to give us better benefits. We need more time at home. We need we need less overtime. My hypothesis was that it would go to all of the hygiene factors, all of the daily gripes that we would listen to, and that they would want things to fix. They would want solutions to those problems. This is what they told me instead. Professionals expect to be able to do the right thing, and the right thing is formed in their training and their professional disciplines, and they expect their leaders to back them when they do that. That's a whole different paradigm. That's not about the hygiene needs. That's about respect the profession that I bring to the daily work of this organization. The second thing they wanted, I want an environment of safety. I want to know that I can make hard decisions and do the things I'm trained to do and not be disciplined for it later. They want to be able to use their autonomy. Listen to what they're telling me here. This is all about practicing their professions. It's not about the hygiene factors. They expect to be able to focus on what matters most, both to the organization and within their professional standards. They expect to be involved in the decisions that affect them, instead of being told what to do, when to do it, where to do it, and how to do it. They expect to be compensated professionally. What happens to a lot of these folks is their professions lag after they've been in the job for 3 or 4 years, and they don't get the increases they think they should be getting. Professionals want to know that they're valued, and compensation is a form of valuing. They expect to be able to meet their own needs while doing everything else. And if they're being required to have mandatory overtime and their weekends are shot, and all of this starts to go away. Yes, they have a calling, but they also have a family and they have other parts of their lives that they want to pay attention to. This is what I was told.
Yeah. Interestingly, in my first company that I had run, it was an employee benefits consulting company, and I used to do a monthly lunch where my assistant would set up a lunch for me to meet with a handful of team members, and she would pick them at random, and we'd go out to lunch. And I called it my best places to work lunch, in that my goal for those meetings was, I didn't have any specific agenda, but just to get to know people, let them get to know me, and ask questions about what makes any place, similar to your focus groups, what makes any place a great place to work? Not necessarily our company, but like what do you value? And the way that I summarize what I heard from people is it matches much of what you're describing in its simplest form. They wanted to be treated like adults. And, that's so sad in a way that, that they would see that as something that they didn't have in many places. Thankfully, in my company, they did. But in many places they had worked elsewhere, they weren't treated like adults. And so to your point, those are what does it mean to be treated like an adult? It means, yes, I'm trusted to make good judgments. I'm backed when I do. I have the freedom to make good decisions about things. I'm a part of the decision making about my work. It's all those things. I'm trusted enough that if I need to take time off, I don't need to document it in 17 different ways because I'm an adult. You can trust me. And that's what people valued more than anything else. And it was striking that it didn't exist in so many other environments.
That's exactly the point. I use the word respect a lot in the first book, Owning the Room, and I amplified it further in Lead with Purpose. This is about respect, human being to human being. A lot of American industry is still Taylor-esque. It's still top-down. It's still a bit autocratic. And this interferes with the idea that we are all professionals working together, practicing our professions as equals, as people who care about one another. And I spent some of my time in the 70s as a community organizer. I understand how to bring communities together, and hierarchy doesn't work really well. And institutional life is a hierarchical structure. We talk a lot about relationships, but the structural context makes a difference in culture as well. How you organize people.
So that brings us to the end of the first part of my conversation with Dr. Roger Gerard, owner of Sloan & Gerard Consulting and the author of Lead with Purpose, Reignite Passion and Engagement for Professionals in Crisis. When we resume in the next episode, we're going to be building on Roger's last question of, what do employees really need from their leaders? There's a lot more to be said on that matter, and Roger has more stories to share, so stay tuned.
This has been Culture Architects with David J. Friedman. Join us next time for more insights and wisdom from great leaders in all walks of life. To book David for your next event, or to learn more about his writing, speaking, or consulting, go to davidjfriedman.com. Culture Architects with David J. Friedman is a production of CultureWise.